You awaken in the middle of the night from a horrible dream that a rampaging seal is loose in the bedroom next to yours. But wait, can that sound still be there even after you wake? Then it hits you. That barking seal is your child coughing. You leap out of bed and run to the room to discover your precious little one is gripped by a bout of the croup. Croup is unmistakable as the vocal cords and windpipes swell and the cough forces air through this narrowed passage. What comes out of your poor child's mouth is the loudest coughing you can imagine, similar to a seal barking. Along with that, their breathing is likely to be labored and noisy, and they may have a fever and a very hoarse voice. What can you do to alleviate their misery and speed their recovery? First of all, keep them calm. That horrible cough that scared you out of your sleep scared them out of theirs too. The symptoms of croup are often alleviated by moist air. If you have a humidifier, now is the time to use it. If not, the American Academy of Pediatrics suggests you take your child into a small bathroom, close the door, and turn the shower onto the highest setting to let the steam build up. Sit in the steamy bathroom with your child, and within 15 to 20 minutes, the warm, moist air should start to calm their breathing. The barking cough will likely remain though. The croup may come back for another night or two. If so, repeat the steamy bathroom method and the croup should slowly subside. If you are concerned that your child has croup, call your pediatrician immediately, even if it's in the middle of the night. While croup is often a result of a viral infection that antibiotics won't help, your pediatrician can suggest ways of treating your child throughout the night, or they may wish to see your child immediately, especially if your child has any of the following signs or symptoms. A noisy, high-pitched breathing sound when inhaling called stridor. They have begun drooling or having difficulty swallowing. They seem agitated or extremely irritable. They are struggling to breathe, or they have developed a blue or grayish tint around their nose, mouth, or fingernails, indicating that they are not getting enough oxygen. Any of these additional symptoms may warrant an immediate visit with your pediatrician. If your pediatrician feels that they can wait until morning to see your child, they may suggest some of the following treatment methods offered by the American Academy of Pediatrics to make your child more comfortable. Hold your child in an upright position. Sitting up can make the breathing easier. Hold them on your lap to soothe or place them in a favorite chair or infant seat. Provide fluids. For babies, water, breast milk, or formula is fine. For older kids, soup or popsicles may be soothing. Warm fluids can also calm coughing spasms and help to loosen the mucus that causes croup. Encourage your child to rest. Sleep will help them fight off the infection that brought on the croup in the first place. Over-the-counter medications such as acetaminophen or ibuprofen may relieve fever. Cough syrups, which don't affect the larynx or trachea, aren't likely to relieve the cough. In addition to moistening the air either through a humidifier or the steaming shower, sometimes breathing cool, fresh air helps. If it's cool outside, you may want to step out with your child wrapped in a blanket and take a walk for a few minutes. Or you can hold your child in front of an open freezer door to let the cool mist soothe their vocal cords. Smoking aggravates croup. If you smoke, do so away from your child so that their condition doesn't worsen. Remove any smoke-infused clothing so that your child isn't exposed to smoke while you're holding them close. Croup generally lasts only a few days, and most kids with viral croup have a fever, some up to 104 degrees, that may last up to a week. Don't be surprised if your child feels better during the day, but the croup returns during the night. This is fairly common. But with prompt treatment, the croup should soon be gone and your nights will be peaceful once more.